I just be normal? Hand me a knife.
No.
Hand me a knife.
No, you're not getting a knife.
I really do not want to continue living. It's all terrible.
You're not getting a knife.
I don't want to continue living.
No.
No, I want to die.
No.
I want to kill myself.
He just describes it as everything's burning. I'm burning. My brain is on fire. Everything is just burning, burning, burning. It just feels like I'm on fire.
My name is Melanie Keeler. Living with a younger brother who potentially suffers with PANDAS or PANDAS can be difficult and overwhelming, but many people can't even begin to grasp the depth of this condition and how it affects children. A majority of people I've spoken to do not recognise this detrimental condition, nor have they ever heard of it. So I wanted to create this documentary to raise awareness of the struggles that families face on a day-to-day basis. If you could just introduce yourself, please, and what you do.
So my name is Dr. Tim Ubi. I'm a consultant paediatrician. I'm also a clinical director of the Children's E-Hospital. I've got a number of different roles which are relevant to PANDAS, and in particular I'm on the Scientific and Medical Advisory Group of the European Immunoneuropsychiatric Association. And I'm also an active member on the UK PANDAS Physicians Network.
PANS or PANDAS is a neuropsychiatric condition which is triggered by a misdirected immune response that results in the inflammation of a child's brain.
The best way to define PANDAS is to look more specifically at PANDAS, which is a post-streptococcal phenomena. And this is something that isn't particularly new. If you go back in history, you look at rheumatic fever and you look at post-streptococcal psychiatric changes. These have been evidenced over time. A child will get a streptococcal infection, and streptococcus is a very common bacterium. It causes things like sore throats and chest infections. As a result of that infection, the child produces antibodies, which is exactly the normal thing that you would expect to do when you get an infection. Those antibodies are designed to fight the infection and get rid of the infection. But unfortunately, because of a concept called molecular mimicry, antibodies also cross-react with a part of the brain called the basal ganglia, and they tickle the brain, and that causes symptoms.
I decided to take the discussion to the public. Even though at first many seemed keen to be part of the documentary, increasingly I got emails from people dropping out. It seemed that they were afraid of the implications of being involved, and I wanted to find out why. I found two parents who were willing to talk about their child suffering from PANDAS.
My name is Natasha Lindsay, and I have a son called Cameron. Cameron will be 19 in a couple of months' time, and we have been on our PANDAS journey from he was 11. We were pretty much a 2.4 bog standard family before PANDAS came to our door. For us, our onset was very sudden. He's very different to what he was when he first took ill.
Right, just try and breathe. Try and breathe and relax yourself.
And the commonest symptoms that we see are things like tics or involuntary movements, obsessive compulsive type behaviours, sometimes disturbance of the interpretation of sounds, which can cause huge anxiety, and other types of symptoms as well.
What happened?
I have described it in the past as like an exorcist, and I have received criticism for that. There was no better way to describe what was happening to him. It was like he had been taken hold of some being. He was violent, he was aggressive. We were receiving black eyes, bruised ribs, broken fingers. So he would come up to me and say, I hope you die in a fiery car crash, and I hope you come back to this house in a box. You know, your head tells you that that's not really your son saying that to you, but it's very difficult to keep that in perspective.
Mum, come here. Mum, sit up with that. I'll help you get changed.
Just make sure you bring him forward when he's in a relaxed.
He was contorting his limbs so badly that we couldn't get him dressed. He was hallucinating and reenacting someone coming into the living room and stabbing him. It was just horrific.
What were doctors' sort of initial reactions when you tried to get your child looked at?
When the onset started and within days things started to go rapidly downhill, we contacted our GP. Within 24 hours, things had got worse. I contacted a friend who was a GP to ask her advice, and she said, record everything. The following night, the bread knife at the throat incident happened. And I rang my doctor's surgery the next day and they said, okay, bring him down. Cameron couldn't sit. His body contortions were so bad that he couldn't sit. The doctor was just horrified. He says, how have you been living like this for a week?
The GP said, that's not epilepsy. And I said, I know it's not epilepsy, but it's something. And because it wasn't epilepsy, they weren't going to even see him. He was having a seizure on the bed. I can't understand why nobody would want to actually examine a child or even see the footage. I didn't even get my foot through the door. The referral was just batted back. No, not seeing this child.
In the UK, we've got a very traditional setup and establishment around two main conditions, autism and Tourette's. Those are conditions that are very well taught in medical school. PANDAS hasn't been taught up to date. And if you look at the data, the current research data, 90% of GPs do not even know about PANDAS, so they don't even think about it in their differential diagnosis when they see a patient. Because they've not been taught about it, they would consider either a behavioural change, they may consider autism, or they may consider Tourette's syndrome.
Take a deep breath in. Take a deep breath in. Yes, you can. Yes, you can.
We went to a regional hospital and they diagnosed him with rapid onset Tourette's. And it was at this point that I was put under surveillance. As a mother, there was suspicions raised about my care of Cameron. It was leaving the local hospital that a nurse came running down the corridor after us, and she said, you need to come back, the doctor needs to speak to you. They had sent some of his bloods off and his strep results had come back completely off the Richter scale. And she said, we're now treating your son for a condition called PANDAS.
I've read up a few articles consider this condition controversial, and they say that the condition itself doesn't exist. What are your sort of thoughts on that?
To say PANDAS doesn't exist is shocking, really. But I knew straight away there was something not right about the way my son was presenting. It really makes me quite cross, really, when I hear people say it's not recognised or it's controversial. It just seems to me that's an excuse not to treat them.
I don't think it is controversial. I think if you look at biological plausibility, you look at rheumatic fever and you look at Sydenham's career, the concept of a post-streptococcal movement disorder should be easily accepted to most people who, have studied medicine in the UK.
What would you use your voice to say to people?
These children are not mentally ill. These children are not psychologically ill. They want to put them into so many boxes. I would like that if a mother or a father goes to a GP and says, my child's behaving quite strangely. They're doing eye blinks with these wee tics and they've all of a sudden got very anxious. I would love for it to be universally acknowledged that in that instance, they don't all of a sudden go, okay, right, here's a referral to CAMHS, that they go, okay, as well as a referral to CAMHS, we'll do some bloods and check for infection.
If you see the huge improvement in a child that's been diagnosed with PANDAS who's received treatment, you cannot ignore that. And that really does give you the energy to go forward and to treat other children with similar symptoms and signs, who you then know you can potentially make significantly better.
For my brother, it took a year before treatment was given, A simple course of antibiotics drastically improved his state from completely disconnected from life to interacting like a normal little boy again. However, he still requires ongoing treatment, as this isn't a cure. This simple treatment, administered early enough, can improve so many children's symptoms.
And when a parent tells you that, when they thank you for giving them back your child, I think that just demonstrates the impact of this treatment.
There are over 4,000 members in the PANDAS support group, with many of these children undiagnosed due to the controversy of this condition. How long will these children remain forgotten in the UK?
Let them argue over the semantics, let them argue over the name of it, let them argue over the details. But look, okay, that's fine. If you want to argue, go and argue in your own time. I have a child here who's critically ill and he needs help. And I don't personally care what you call it, you just need to help him.
My name is Mark. PANDAS is real. I've had PANDAS for the past 6 years of my life. Unfortunately, I have to pay the price for your ignorance. I've been told I'm an attention seeker, but I've seen to find the true definition of attention seeking. When you became a doctor, you took an oath to do no harm.
I've had PANDAS for 3 years, and it has been really hard. I feel hallucinations, headaches, anger problems, intrusive thoughts, and OCD.
PANDAS is an illness that gets in your brain, so don't start thinking you're going insane. If you're thinking strange things, it's just OCD, or as I like to call him, crappy controlling. We all have bad days telling ourselves it won't get better. Well, just trust your parents, or if you don't want to talk, write them a letter.